In this video, we'll explore 12 unusual signs that could indicate damage to your liver. It's crucial to know these signs because you can take steps to prevent the disease from getting worse. Your liver has a remarkable ability to heal itself with some assistance. The prevalent belief that liver damage primarily results from excessive alcohol consumption is somewhat misguided. In fact, an overload of sweetened and processed foods and beverages, excessive intake of omega-6 vegetable oils and fast foods, frequent use of painkillers such as acetaminophen or ibuprofen, viruses leading to liver damage, and hepatitis, among other factors, and the list goes on and on. If you want to check for liver issues, stick around and watch this video all the way to the finish. We'll also discuss some simple home remedies to detoxify your liver and stop further damage. The initial sign of liver issues is having light-colored stools. When you go to the bathroom, your liver sends out bile acids to assist in digesting fats from the food you eat, giving your stool its typical brown hue. But if you're dealing with fatty liver disease or liver damage, this bile flow can become disrupted, resulting in lighter or clay-colored stools. In some cases, the stool might even float on the toilet water due to undigested fat, making it buoyant. Number 2 involves experiencing difficulty with night vision. If you find it challenging to see clearly in low-light conditions, especially at night, it could be a sign of a deficiency in retinol or vitamin A. Your liver's bile production plays a vital role in helping you absorb vitamin A, which is crucial for the rod cells in your eyes to adapt to varying light levels. Liver disease, however, can disrupt this process, leading to inadequate vitamin absorption, resulting in what we call night blindness. This symptom may also suggest a congested gallbladder, particularly if you also experience dry, sore, irritated, and gritty eyes. The third symptom is a swollen right foot. When the blood flow in your liver isn't as it should be, it can lead to swelling and enlargement of the liver, which in turn exerts pressure on the portal vein. This can result in the accumulation of fluid or water in the legs or feet. When you press your finger into the swollen area, it may leave an indentation. If you observe that your right foot or ankle is more swollen than the left one, this is a common sign of potential liver damage. We'll delve deeper into natural remedies for improving liver function later in the video. Sign number 4. White eyelid growths. Another unusual indicator of liver damage is the emergence of small white or yellowish growths around your eyelids. These are tiny collections of cholesterol deposits that accumulate beneath your skin due to the liver's inability to break down cholesterol effectively, leading to its buildup in various parts of the body. Sign number 5 is experiencing pressure on the right side. Another potential indication of liver disease is the sensation of pressure or discomfort on the right side of your rib cage, particularly after eating. Liver damage can lead to the bile becoming thick and sludgy, which can block the small tubes connecting to your gallbladder, resulting in a feeling of pressure and discomfort around the ribs. This pressure can also affect the phrenic nerve, causing muscle tension and pain in the region around your right shoulder. Sign number 6 involves the presence of purple and red spots. When your liver is congested, inflamed, or impaired, it produces fewer proteins necessary for proper blood clotting. As a result, you may be more prone to bruising, and occasionally you might notice unusual purple or red bumps resembling a rash on your skin, along with small red patches. This often occurs in areas like the lower legs or arms and is attributed to the diminished blood circulation associated with liver disease or possibly diabetes. Moving on to sign number 7, we have cracked heels. Your body relies on vitamin B3, also known as niacin, to maintain the strength, smoothness, and moisture of your skin to prevent it from getting damaged. But if you're dealing with liver disease, your body redirects its niacin reserves to repair the liver damage, leaving less of this essential nutrient for other functions. This can lead to the skin on the soles of your feet and heels becoming dry and cracked. So you can address this issue by increasing your intake of vitamin B3 and addressing the underlying problem, which is often fatty liver disease. Another symptom of liver disease is experiencing a persistent urge to scratch or itch the palms of your hands or the soles of your feet. This condition arises due to a buildup of bile acids beneath the skin, resulting from the liver's inadequate filtration of these acids. This buildup leads to an accumulation of histamines in the bloodstream, triggering the itch sensation. Sign number 9 is having all white or clubbed nails. If your fingernails start to turn completely white, losing their natural pink color, or they adopt a rounded, clubbed, or bulbous shape, it may be a sign of significant liver damage or another underlying health issue. This condition can hinder the delivery of oxygen to the nail matrix. Interestingly, in the 1950s, researchers found that 8 out of 10 individuals with severe liver scarring had nails that were entirely white. Sign number 10 is dark urine. Your liver plays a crucial role in breaking down old red blood cells, which contain a yellowish pigment called bilirubin. When your liver or gallbladder sustains damage, this pigment can accumulate in the body and eventually get flushed out through the urine. As a result, your urine may take on a very intense dark orange, amber brown, or cola-like color because your liver isn't processing the pigment as it should. Additionally, certain medications, such as antibiotics, sleeping pills, or birth control pills, can also contribute to this discoloration by placing strain on your liver. Sign number 11 is yellowed skin. When your liver is not functioning correctly and is unable to effectively filter bilirubin from your blood, it can lead to a change in the color of your skin. This can result in a yellowish hue on the skin, a condition known as jaundice. Jaundice is a clear indication of significant liver damage, which could be due to conditions like hepatitis, cirrhosis, or drug or medication poisoning. If you experience yellowing of the skin, it's crucial to seek medical attention and consult your doctor. Lastly, sign number 12 is the presence of spider veins. Spider veins resemble tiny red dots with spider-like extensions of blood vessels that become visible on the skin. These are blood vessels that have suffered damage because your liver is not effectively filtering out excess estrogen. Elevated estrogen levels can weaken the blood vessels in the veins, leading to their dilation and the appearance of these spider-like veins on the skin. If you experience any of these symptoms we've discussed here, it's strongly advisable to schedule a visit to your doctor and request an ultrasound examination. How to reverse liver disease? As mentioned earlier, the liver undergoes 4 distinct stages of damage. Initially, it accumulates fat, followed by inflammation and the formation of scar tissue known as fibrosis. In the most advanced and potentially life-threatening stage, it progresses to cirrhosis. Fortunately, there is hope because the liver possesses the remarkable capability to fully regenerate and recover when you make dietary improvements and employ the appropriate remedies. So let's go through the most important steps to reverse liver damage. 1. Improve your diet by reducing your intake of sugary, starchy, and flour-based foods, such as bread, cookies, candies, ketchup, pancakes, pasta, and soda. A fatty or impaired liver is responsive to fructose, which is the sugar found in fruits, much like it is to alcohol. 2. Incorporate plenty of bitter and sulfur-rich foods into your diet. These include leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, wild salmon, oily fish, walnuts, onions, scallions, and broccoli sprouts. Foods rich in sulfur can aid in reducing fat buildup in your liver by increasing glutathione levels and supporting the detoxification of harmful substances. 3. Start your day with a cup of homemade organic coffee, adding a teaspoon of turmeric. The polyphenols in coffee and the phytonutrients in turmeric are effective at reducing the formation of scar tissue in the liver and promoting its repair from damage caused by alcohol, drugs, or fructose. Additionally, aim to consume at least 1 liter of high-quality mineral water throughout the day to help thin your blood and support the liver in producing bile to break down fatty deposits for enhanced toxin filtration. In your liver, consider adding freshly squeezed lemon or lime juice.